and I'd like to take this opportunity to introduce Mr. Everett to all of you. We're really excited to have him speak to all of you today. I think that you'll find his presentation both entertaining and informative.
We'll see.
He's a great guy. Jeremy Everett is the founder and executive director of the Baylor Collaborative on Hunger and Poverty. The collaborative integrates research and practice through projects such as the Text for Hunger Initiative, the Research Fellows Program, the Global Hunger and Migration Project. In addition to that, the collaborative works across 7 regional offices with nearly 100 staff, interns, and researchers, and have assisted in local community, state-based, and national efforts to increase hundreds of millions of additional meals through innovative research-based interventions. In his tenure with the collaborative, he has raised more than $250 million to support faculty research, public service, and policy analysis. Prior to his appointment at Baylor, he worked for international and community development organizations as a teacher, research leader, community organizer, and a farmer. I remember that. And you like coffee?
Very much so.
And we have a coffee center we'll talk to you about. In addition to that, he is also, he earned his bachelor's degree from Stanford University, a master's of divinity from Baylor, and is finishing his doctorate at Duke Divinity School at Duke University, which is in Durham, North Carolina, which is near one of the greatest universities on the face of the earth, the University of North Carolina at Chapel Hill. For those of you who aren't familiar with that, the oldest state-supported university in the country.
And it used to have a basketball team, as I understand.
When you quit, I don't think y'all heard what he said. He said, we used to have a basketball team. We still do.
That's true.
So for those of you, Keith Cole gave him this. Is this your latest book?
It is. Yep.
I Was Hungry, which is his latest publication. And so, Jeremy, we are so honored and pleasured to have you, and
thank you.
It's all yours.
Thank you. Well, I'm very grateful to be with you all. Many of you work in some legendary spaces and have been doing some incredible work that our team at Baylor has been following for a long time. Dr. Morano is on our new board, our board of advocates or board of advisors. And so I'm very grateful for her and her leadership and wisdom, being able to lend that to us. I've known Ambassador Boss's name since day 3 or 4 of when I took this job in 2009, and so one of my good friends is the regional administrator for USDA Southwest Region, Bill Ludwig, and Bill served in a number of capacities at USDA, but he always speaks very highly of Ambassador Boss. So he's the one guy. He's the one guy that speaks highly. So
at least there's one.
Yeah, that's right. We all need a fan.
That's exactly right. Robbie, did you hear that?
That's
There's
right.
At least one.
Well, I want to talk to you a little bit about some of the work that we've been able to do at the Baylor Collaborative over the past 13 years. Like most of you, we envision a world without hunger. And we certainly think that there's an opportunity for us to end global hunger. Much of the reason is directly tied to the work of A&M and the work here in your agricultural school. Because now we produce enough food for everybody to have access to it. You know, so 40, 50 years ago, most of the times when you had issues of global hunger, it was directly tied to famine and production. But now we're producing enough food to ensure that everybody would have access to it. The problem, oftentimes, is that they don't have access. And so one of the questions is, why don't they have access? If we're producing enough food, where are the gaps in access? So I want to talk to you a little bit about what we've done in the U.S. to increase access to predominantly federal nutrition programs. And then I want to talk to you a little bit about how some of these methodologies are methodologies that we'll be exporting to some other countries in the very near future. Well, thank you again for the invitation to be with you today. The Baylor Collaborative, we envision a world without hunger, and we see our role in it as creating scalable solutions to address hunger. And we really do that through in 3 priority areas. So the first is building multi-sectoral collaborative interventions. And I feel like I can be wonky with you all because we're all wonks together. But essentially, what we have identified is that no one sector or one organization has the capacity to end hunger by themselves. It inherently requires everybody working together in a collaborative capacity, identifying where those gaps of services are and working together to address those gaps in a very strategic and long-term way. Now, most of these issues that we're all addressing, whether it's hunger or poverty in the U.S. or around the world, didn't happen overnight, so we're not going to end them overnight. Oftentimes when we're working with foundations and different agencies, they have a tendency to want to end a systemic problem in a grant cycle. And it's like, well, if it took us 400 years to create this problem, we're probably not going to end it in a 2-year period with a $2 million grant, right? But we could certainly make some headway. So our organization really focuses first and foremost on building these multi-sectoral collaborative projects. So how do industry and the government sector work alongside the nonprofit sector and faith community? The second priority area for us is expanding access to public programs. We've got a wide array of public programs, both nationally and globally, that are oftentimes underutilized because either communities don't know that the programs exist, or they don't know how to utilize them or access them in their fullest way. The third area for us is in the research and development space, and that's where we're identifying populations that are disproportionately affected by hunger and poverty, and then developing some innovative solutions to addressing those particular issues. So those are the three areas that we work. Now we have a three-pronged approach for everything that we address. And so we bring research alongside practice, and all of that informs our public policy work. And the reason that we do research and practice, like many of you do that are affiliated with the Borlaug Institute, is we recognize, like Brian Stevenson, the author of Just Mercy, says, you can't solve a social problem from a distance. You have to have proximity to the problem. And we all have been around research enough to know that many times, even when you have the best intentions and the most up-to-date data, the solutions that we develop in academia, if they are disconnected with proximity, they're almost inevitably not going to work. But when you have research working alongside people that are embedded in communities in real time, our solutions are more likely to be accurate and more likely to be scalable. And that's what we translate into our work with federal agencies and with Congress in the U.S. Does that make sense? Okay, so let's understand the problem. So many of you work in a global environment, so I'll talk a little bit about the problem of hunger in the U.S. About 5 years ago, I had the privilege of serving on a National Commission on Hunger. So there were 10 of us that were appointed by Congress. Our job was to evaluate largely USDA's programs to see what was working to address hunger, and then why were there such big gaps. At the time, we had 40 million Americans that were considered food insecure, about 7 to 8 million that were very low food secure, meaning that they were in a situation where they were experiencing hunger with regularity. We spent the first year, 5 of us were appointed by Republicans, 5 appointed by Democrats. We spent the first year in DC around a table that was a national archive, but so you couldn't put your coffee cup on it. But we largely just spent our time bickering with each other. Now, we had access to the same data, the same research, and we spent time that year combing through the research, but we would just argue about how each of us were interpreting the research. But we were committed to coming up with a consensus report and making that available to then President Obama and Secretary Vilsack in his tenure with President Obama and to Congress. So we knew that if we were ultimately going to develop any kind of solution or have any kind of consensus recommendations, we were going to have to leave DC in order to do that. So we spent the better part of the next year traveling around the U.S., meeting with individuals that were food insecure and experiencing hunger and poverty, listening to organizations and meeting with organizations that were addressing it on community-based levels, and then holding public hearings so that anybody that wanted to have their voice heard on congressional record could do so. One of those trips took us to the American Southwest, where we traveled around and visited tribal communities, met with elected officials and food insecure individuals. But the trip culminated in El Paso, Texas. Now, we had an office in El Paso, Texas, so I felt like I knew the community pretty well. But the LaFay Community Center there hosted us for a meeting with a group of elderly members from the community who had met each other in a citizenship class that they were taking. Now, most of them had lived here in the U.S. their entire lives. They'd raised their children in the U.S. Several of them had children serving in active duty in the Middle East as we spoke. All of them were experiencing hunger. And they were trying to raise enough money so that they could pay for their citizenship class test because they wanted to die a U.S. citizen. And so as we spent time with them, listening to them, towards the end of our conversation, I asked them pointedly, I said, do you have any food to eat at home? And they all didn't, no one wanted to make eye contact. They all kind of started to look around. And one very proud man with a real chiseled chin and a sharp mustache just put his head on his cane and he began to weep. His wife was next to him and she straightened up her dress. It was her Sunday best. And she looked at me right in my eyes and she said, sometimes we're able to put food on the table. When we eat, I'll make us a plate of beans and maybe a couple of tortillas, and that gets us by for a few days. After she said that, another individual raised his head and he looked at me pointedly right in the eyes and he said, remember us when you come into your kingdom. Well, I come from a Christian background and I've read words that say, remember us when you come into your kingdom over in my life over and over again. We sing a song that repeats that in like a chant form in my church. As many times as I've sung that song or read that verse in scripture, I've never in my life thought about me living in a kingdom right now. But he was right. We were going to leave that meeting and return to a nice hotel and have a nice meal. And then we were going to return to the halls of power in D.C. to be able to share what we had learned. Remember us when you come into your kingdom. So the next day, we came back to that same community center in a very large room, and there were hundreds of people there already by the time that we arrived. They were standing shoulder to shoulder and seated in all of the available seats because we were having a public hearing that day. Now, we expected that we might have 6 to 8 hours of testimony, and that we'd invited people to come provide testimony. We didn't expect to be there for 10 to 12 hours just listening to anybody that wanted to come up and have their voice heard. But one of the invited testimonies was from one of your former faculty, one of your retired faculty, Joe Sharkey, public health faculty member. Joe was responsible for a research project on the Texas-Mexico border in the colonias. And so he would hire promotoras, or essentially public health workers or community workers from the colonias to go door to door to take surveys to check on the health and well-being of community members. One of his promotoras knocked on the door of a local resident, a woman named Linda. And Linda invited her, the public health worker, into her home, and they sat down together in an area that kind of served as the living room. And if you're not familiar with the colonias on the Texas-Mexico border, homes oftentimes can be put together with whatever resources somebody might have at the time. So you might have one wall that's made of plywood, another that might be made of stacked tires, and then another that's rocks stacked together from the surrounding land. And sometimes they have electricity, sometimes they have running water, many times they don't have either. And the way that colonias work is that people are essentially leasing land to put their home on, but they don't have a lease agreement, so the landowner can come and take it anytime that they want. Well, this promotora was sitting down with Linda, and then she was asking and kind of checking on her to see how she was doing. This particular colonia actually had electricity, and Linda had a small refrigerator in an area that served as her kitchen. And towards the end of their conversation, the promotora asked her just the same question that I had asked the elderly group the day before. She said, do you have any food in your house? And Linda kind of lowered her head under the weight of shame and guilt, and invited the promotora into the area, her kitchen area, and allowed the promotora to kind of open up the shelves and then open up the refrigerator. And the only thing that was in her refrigerator was a little bag of chicken bones. The promotora said, why in the world do you have a bag of chicken bones in your? She said, this way when my kids get home from school and they open up the refrigerator door, they'll at least see that something's there. When I heard this, I was presiding over this hearing and just fighting back tears. I just kept thinking, surely we can do better than this. In a nation as wealthy as ours, at a time in our world history where we are producing enough food, for a woman to have a bag of chicken bones so that our kids could just feel like something is there seems incomprehensible. But unfortunately, that is the state of the union for many millions of Americans, many people living in our country and people living across the globe right now. Our economic hardships are not evenly spread out among society. Rather, it's the same family that experiences bouts of hunger that also doesn't have affordable health care. It's the same family sending their kids to schools with graduation rates well below 50%, and college readiness in the single digits. It's the same family that have lacked livable wage paying jobs for generations. They are our scapegoats, sent to live in these deserted urban neighborhoods and rural trailer parks and colonias that we try to avoid in our nation. Surely we can do better than that. Well, our commission and many of our researchers have spent their lives devoted to better understanding the causes of food insecurity in the U.S. The primary cause is underemployment, meaning that people are employed, they're working, but they're oftentimes making minimum wage paying jobs. And if you make the federal minimum wage of $7.25 an hour and you're able to get 40 hours worth of work a week, 52 weeks out of the year, you're still bringing home less than $15,000 a year. Well, in most places, even places like College Station and Waco, Texas, that aren't overly expensive places to live, you can barely pay rent, much less afford child care costs, health care costs, food costs, and so forth. What makes matters worse is that when you're working a $7.25 an hour job, rarely are you getting full-time employment. Most of the time, you're getting maybe 20 hours one week and 15 hours the next. And so people try to splice together as many jobs as they can. But I don't know about you, I've worked a lot of minimum wage paying jobs in my life, and my supervisors would never call each other to coordinate to see when I was available to work, right? They don't say, hey, can Jeremy work the morning shift this week so that he can work the afternoon shift next week? You know, that they're not coordinating. So inevitably, your job shifts end up competing, and you end up losing a job because you continue to miss one job over the other. This sets up what's called income volatility, meaning that week to week, you can't possibly predict how much money you're going to make because you don't have control over the amount of hours that you're working. So one week if you get 15 hours, and the next week you get 20, and the next week you get 5, you don't know how much monthly income you're going to have. Well, certainly this was exacerbated during the pandemic. So especially in the early parts of the pandemic when businesses were shut down. And so if you remember, businesses would be shut down for a period, and then they might open for a week, and then they might be shut down again. And so income volatility was off the charts. It was like a roller coaster for low-income Americans. Unfortunately, they still haven't really recovered like many of us have who have come through the pandemic fairly well or fairly unscathed economically. There are other areas that directly impact food insecurity in the U.S. One of Rudy's colleagues, one of our researchers, Dr. Craig Gunderson, is looking into disability. If you live in a disabled household with somebody that has a disability, that is the most common predictor of food insecurity at the household level in the U.S. Certainly, you can think about people who are incarcerated. You're 3 times as likely to be food insecure if you've been incarcerated in the U.S. Structural racism still plays a key role in predicting the amount of food insecurity among minority households. So all these are contributing factors, and what is common among these factors is that when you experience them, you're forced to make trade-offs each month. Because you don't make enough money, hunger in the U.S. is episodic. It's not like what we're seeing in Afghanistan, and many of you are working in that space right now, and God bless you in your work. But what we have in the U.S. is hunger is episodic, so people are experiencing hunger at the end of the pay period, and so they're forced to make trade-offs. They have to decide each month, am I going to pay for rent, or a car payment, transportation cost, or child care cost, or health care costs, or pay for medicine or food. If they don't pay their car payment, their car's repossessed and they can't get to work. If they don't pay rent, they get kicked out of their home. So oftentimes they make food that trade-off. So either the parent chooses not to eat towards the end of the month, or they try to stretch their food budget by eating cheap, heavily processed foods that get them through the end of the month, but we also know take a physical toll on their bodies. That's the state of the union when we talk about food insecurity in the U.S. Now, one of the things that's been interesting that I did not anticipate, so as the ambassador mentioned, my background is in theology and divinity. So supply chain logistics was not something we studied when I was in seminary, and so I've had to be schooled by my colleagues in learning supply chain logistics. And I think there was a reason that I went to divinity school, and they seem to insinuate that a good bit. But one of the things that we've learned is that oftentimes, think about the work of the Borlaug Institute in Afghanistan, or think about the work that you've been able to do in Guatemala, or different places across the planet. Most of the time, your ground game, the work that you do in communities, is done by faith-based organizations. So Baylor, here we are, a large Christian university, the largest in the U.S., and here we are, trying to figure out what is our role in this particular space. Well, this is part of our role, is really kind of leaning into and understanding the role that faith communities can play in helping solve and address these crises in a more comprehensive way. So for me, I needed to go back to scriptures. What do different scriptures say so that I can better understand our collective experience? So in the Quran, it says, if you go to bed while your neighbor goes hungry, you're not one of us. That's pretty definitive. For those of us who come from a Christian household, that is definitive. Hindu scriptures say to give food is to give life. And if you think about when we're eating, oftentimes eating is not just an act to take care of your own body and your physical health. It is a social experience. You're eating it with your family. And so you think about how the richness of the word life in this context. To give food is to give life, because you're sitting across the table from somebody else and you're sharing in food and in commonality together. The prophet Isaiah in the Hebrew scripture says to spend yourself on behalf of the hungry and your light will rise like the noonday. All these different traditions are pointing to a common issue, and it's something that we can come together on. Now, I come from the Christian tradition, and so many of you who also come from the Christian tradition are probably familiar with this passage in Matthew. It says, when the Son of Man comes in all of his glory and all the angels are with him, then he will sit on the throne of his glory, and all the nations will be gathered before him. And he will separate people as a shepherd separates the sheep from the goats. He will put the sheep on his right hand and the goats on his left. And the king will say to those on his right hand, come, you that are blessed by my Father, inherit the kingdom prepared for you from the foundation of this world. For I was hungry, and you gave me food. I was thirsty, and you gave me something to drink. I was a stranger, a migrant, and you welcomed me. I was in prison, and you visited me. And the righteous will answer him, Lord, when was it that we saw you hungry and gave you food, or thirsty and gave you something to drink? And when was it that we saw you a stranger and welcomed you, or naked and gave you clothing? And when was it that we saw you sick or in prison and visited you? And the king will answer them, truly, as I tell you, as you did for the least of these who are members of my family, you did it for me. This is the only end of the world scene in the entire Gospel of Matthew. And Jesus has painted a picture of a very different type of kingdom, just like our friend did in El Paso. He's returned and all the people are gathered, and he begins to separate them, the sheep and the goats, the righteous from the accused. And to the astonishment of the people gathered, the criterion for judgment wasn't confession of faith in Christ. Nothing was said of grace, justification, or the forgiveness of sins. What mattered is whether a person had acted with love and cared for the needy. These acts weren't just extra credit, but constituted the decisive criterion for judgment in this passage. So essentially, when people responded or failed to respond to human need, they were in fact responding or failing to respond to Christ. So the calling of the faithful in all of these traditions is to feed the hungry and you will live. So how do we do it? How do we do it? First and foremost, what I believe is that it's honestly been treated as a cosmetic intervention, meaning that it's something that we think is great and it's neat if we get organizations to partner and work together. That's neat. Oh, isn't that neat? Texas A&M and Baylor are working on a project together. Who knew? Right? Or isn't that neat? Feeding America and the Food Research and Action Center are partnering together on an intervention in Middle America. Or Food for the Hungry and Catholic Relief Services are doing a project. Isn't that neat? But we don't see it as critical to actually ending hunger in our time. But the reality is, if we do not get all of the organizations, and I mean the local church, all the way up to USAID or USDA or the UN World Food Program or Hormel Foods, if we don't get everyone working together in a common direction, there is no hope of us actually comprehensively ending hunger in the U.S. or anywhere on the planet. So forget about it. If you're designing an intervention that you think will end hunger in a particular community by yourself, it will not. Now, it might have a positive impact, but it's not going to comprehensively address this issue. And I almost feel like it's a divine practical joke that in a time when we are as polarized as we are, the only solution for us to address these big structural issues in our country and around the globe is to work together. Isn't that ironic? So we build hunger-free community coalitions. Our job is to go into communities and build these coalitions. I'll give you one little anecdote before I move into it. When we kicked off our work 6 years ago, Bill Ludwig and I would go around Texas doing town halls where we would encourage communities to develop these hunger-free community coalitions. And we traveled, it was kind of like Beto, we traveled to all the counties and did all these events. And most of the time, these communities would gravitate to it. They wanted to get involved. They wanted to work together. But oftentimes they didn't have the support of the community. They didn't have the wherewithal to be able to say, hey, we're going to designate, Ambassador Boss to be able to be the organizer for this particular coalition effort. And so the coalitions would come and go pretty quickly. So we quickly realized after about 2 years of this and wearing each other out, we had to begin to provide backbone support, some staffing support for these coalitions if they were going to work, because we recognized that organizations that are addressing hunger on the local level are overwhelmed with need. They don't have time to oftentimes, they see it as a luxury to bring these coalitions together. So we identified 6 communities in Texas where we had pilot communities. And after about 6 months of working with these pilot communities, we got a phone call from 2 women in West Texas, Mary and Carol. And they picked up the phone, they said, Jeremy, we just had 3 manufacturing plants close. We now have 10,000 children on our free introduced lunch program, and we don't know what to do. Can we be a pilot community? And well, I said, I'm sorry, unfortunately right now we don't have any more bandwidth to take anybody else on. Can you call us back in a year and maybe we can take you on then? Well, who here is from West Texas? Do we have any West Texans in the room? I'm married to a West Texan, and I should have known better. And so these women, they didn't say, okay, we'll call you back in a year and hang up the phone. They just started yelling at me. And they said, Jeremy, I don't think you understand. We have 3 manufacturing plants that just closed in our community. We have 10,000 kids on the free introduced lunch program now. We don't know what to do. We have no plan. Can we be a pilot community? I knew my only chance to get them off the phone was to talk to them through our community assessment tool that we take communities through. And at that time, it wasn't as strong as it is now with all the researchers that we have. And so typically it would take a community 6 to 9 months to go through that period. So I thought at the very least, I'm equipping them with 9 months worth of work. Then that may give us time to expand our bandwidth to be able to support them. 3 weeks later, they called me back and it was done. They had the mayor, they had the city council, they had the school superintendent, the school board, the bank presidents, the churches from all different denominations and faith perspectives, all represented saying, we're in and we want to be a part of this hunger-free coalition. And so they called me back and they said, so can we be a coalition? And I laughed and I said, I think you already are. So Bill and I traveled back to West Texas to go sit down with these women in San Angelo, Texas. Before we could get done with our little road show, the churches said, hey, we've got commercial kitchens and we'll make meals for kids during the summer. And the nonprofit organization said, hey, well, we're strategically located in areas of high poverty communities, and the city park said, so are we, and so we'll be summer meal sites. And the banks and the other organizations said, well, we'll help raise money and we'll provide volunteer support so that we can get this program off the ground. In just a few months of planning, they served 20,000 meals to kids in that community, just because they were working together and they knew that they could do more together than they could apart. We've since replicated that model. We've expanded summer meal sites in Texas from 2,500 summer meal sites to over 10,000 summer meal sites. And we now have about 30 coalitions representing 17 million people, largely based on these, on these interventions like Mary and Carol pulled together on the local level. That's not different than a lot of the work that you do in a global environment as well. So one key area that we have to improve upon on a federal, state, and global level is we have to build multi-sectoral interventions. Otherwise, what ends up happening is you have duplication of services by one hand, and then gaps of services that nobody's addressing because we simply don't do an analysis to see who's doing what and where they're doing it. Second thing for us is, and I want to get into some Q&A. So when you think about how you maximize federal programs or access to federal programs, in the SNAP program, so I know Rudy's done some research there, and so has our colleague Craig Gunderson. What used to be called the food stamp program, in most counties in Texas, you have about a 57% participation rate, meaning that of 100% of the people that would be eligible for the program, only 57% are actually participating in the program, because we don't believe, we have not invested in a strong social safety net. And so most of the times they only have access at places like a government agency office that's open from 9 to 5, Monday through Friday. But people, again, remember, they're underemployed, they're working, so they're oftentimes not able to get there, or they don't know that they're eligible for the program. And so one of the things that we have done in partnership with the state of Texas and with AgriLife is we created a community partner program where we identified community-based organizations that could be access points, trust-based organizations that could be access points. So nonprofits and faith communities that could be trained, where you have trained personnel to be able to increase access for individuals in the community. So that is a program. When you don't utilize it, here's what it does from an economic impact standpoint. We leave, as a state, billions of dollars, typically about $2 billion a year, on the table in federal resources that we are not utilizing for our lowest income Texans. That money would immediately go into the pocketbooks of people that are working, underemployed, to help provide them resources so that they can go buy food in the local grocery store. What we heard from our grocery store partners is that that program accounts for 1 in 10 of every job that they have in their local grocery store. So you're talking about a huge economic return. Right now it's estimated that for every dollar that comes into a community through that program, you have $1.79 worth of economic stimulus for that community. So you're creating a lot of jobs and feeding the hungry. That's what we talk about, maximizing these public programs. You think about school feeding programs that are run by the World Food Program at the UN, right? Imagine the economic impact that would have if we increase 1 million kids in Guatemala on school feeding programs. That reduces the need for migration, increases resources for the local community, because they've got to buy the food and somebody has to make it. And so you see the benefit, the economic power of these programs. One last program that I'll mention, when we think about innovative access, one of the things that we identified when I was on the commission, and that was backed up by our field offices around Texas and our organizational partners, is that the interventions that are working to address domestic hunger in urban areas don't translate to rural communities. And so oftentimes we don't have nonprofit organizations in rural communities in the U.S., right? And so the summer meal program doesn't seem to work. The Department of Ag has a program in partnership with us, and several years ago they required any school district that was responsible for administering a summer meal program, if they were trying to opt out, essentially say, hey, we can't serve summer meals, they had to call our office. And at the time they had to call me and request permission to opt out of the program before the state would agree to that. But part of the reason that they added us they inserted us into the process is so that we could work with them to come up with an alternative plan. But most of the superintendents I heard from, they all said, hey, we want to offer summer meals. That's not the problem. The problem is that our children live 45 minutes in one direction from our schools. It's not cost effective for us to operate the program. So we, with some of our, with a company called McLean Global, partnered with USDA to develop an intervention we call Meals to You. And it's a model where we, since we can't get kids to summer meal sites, where we mail a box of food, a week's worth of summer food, directly to the front porches of children in rural America. We tested the program out in 20 school districts at East and West Texas, with 4,000 children on a 10-week demonstration program in summer of 2019. And it was one of the smallest projects that we were administering as an organization at that time. It was just kind of another neat thing that we're doing. Oh, that's neat, you know, that's great. We'll see what the impact is. Several evaluations team monitoring the effectiveness of the intervention. And it seemed to work. After the first summer, we served 500,000 meals and snacks to children in these school districts that would not have otherwise received a USDA summer meal had they not participated in the program. At the end of the summer, we sat with the undersecretary in Eustis, Texas, East Texas, with hundreds of people that had come in to a town hall to kind of talk about the program. And many of the moms were just weeping, talking about how much impact this made for them during the summer with their kids, because they didn't get a pay raise once the kids were home and out of school. They just have to eat those costs, those extra food costs. And it was remarkable hearing from them. We were planning to expand the program to New Mexico and Alaska at behest of Congress when the pandemic hit. And Secretary Perdue called, and his undersecretary Brandon Lips called to see if we would be willing to expand it nationwide. We thought maybe 25,000 kids would participate. Within the first week, we had over 50,000 kids in the enrollment process. Within 2 weeks, 150,000 kids and there ended up being over 270,000 kids that chose to participate in the program in 43 states plus Puerto Rico. We had children literally that were receiving boxes of food via dog sled teams in the Arctic, in Alaska, and seaplanes dropping boxes of food off in island areas across the Alaskan area. In addition, we had boxes of food being delivered by mule teams down to the Havasu tribal community at the bottom of the Grand Canyon, and UPS drivers delivering boxes everywhere else. It took the private sector and the public sector and the nonprofit sector and universities all working collaboratively to serve 40 million meals to kids when schools were shut down during the pandemic, and the program continues. So that's the kind of work that we are able to do, and so I'll leave you with this. So William Wilberforce was a British parliamentarian in the late 1700s, and he is largely credited for ending the British slave trade. But one of his biographers said that may not have been his greatest accomplishment, that his greatest accomplishment was ending the very idea that slavery was an acceptable form of commerce. Because until that point throughout human history, that was just the way you did business. That was the way you generated wealth. Well, likewise, I think the onus is going to be on us, all those of us in the room, for us to end the idea that hunger and poverty are acceptable social conditions. And if we do, then we know the students that are coming through your doors and the students coming through our doors will be able to develop the solutions that will innovate and take us to a hunger-free world. So, thank you.
Almost 20 minutes for questions.
I wanted to ask you, do you know whether or which country, developed country around the world, European, wherever it may be, where maybe they're doing this better than most? Nobody's perfect, but that maybe we can look at how they're doing this, that is working for them, that we might be able to learn some things that we can apply here in the U.S.
Yes. So it's not a country, but it's more of an agency. And so disaster preparedness, both in the U.S. through Homeland Security and through the UN's Disaster Preparedness Office, has done a good job of building public and private infrastructure to be able to respond to disasters. We consider disasters politically nonpartisan, right? And so in the U.S., we have incident command centers set up in every county in the U.S. so that if there's a wildfire or a hurricane or any other disaster, that you have a team of people that are trained and equipped at addressing that particular issue. As it relates to one of the things in disaster preparedness, as it relates to hurricanes, is that you can't send people back home until grocery stores open, right? And so you have to have grocery stores at the table. You have to have plans to be able to connect people to loved ones when they get split apart in disasters. And so I think that when it comes to developing multi-sectoral interventions and recognizing the importance of all these different sectors and why they need to be at the table and why this has to be a coordinated response, I think that sector is doing it best and really piloting it for the rest of us. And we see that sector doing it in a way where it's like, well, of course they're doing it. But oftentimes we don't say, well, why aren't we? And so we've allowed competition in the negative sense to move us, to prevent us from moving into a spirit of cooperation and working together. And recognizing we all don't have to be good at the same thing. Like the gifts, one of the reasons that we love the Borlaug Institute, and Dr. Price and I were just talking about this with this Center on Conflict and Development, is if we're going to be successful at the work that we do, we have to ensure that we are producing enough food. Otherwise, access isn't the problem, right? It's production. If we are going, and so our organization is being invited by the World Food Program and some others to go in and establish these multi-sectoral interventions in the Northern Triangle, because they want to expand participation in their programs from 1.8 million people to 8 million people over the next 5 years. And so they want to have this kind of public and private infrastructure built, but that's not what they do. That's not that they administer programs. And so so if we want to do this well, I think that we're going to have to recognize that if you're doing your thing well, and the Center on Conflict is intervening in these areas of conflict, and we're working on food act, then all of a sudden we're building quite a strong intervention that can actually have some success, and in this case, reduce forced migration, which is one of the issues that we're certainly looking into there. Yeah, good question. Other thoughts or questions or ideas? You all are the experts, so. Yes, sir.
You mentioned early on when you were working on the commission that there were 5 Democrats and 5 Republicans in most of the first year of Pickering. With our current political divide just every day, what do you find is the best argument for what you described here today, that regardless of ideology, people respond to?
I don't know if it's the best argument as much as I'm not somebody that's going to quote Stephen Covey a whole lot, but he does have a great quote that says, "Leadership moves at the speed of trust." And I think one of the things that we've forgotten how to do is build relationships and cultivate trust. And so oftentimes we're looking at somebody and we see their political affiliation before we can see who they are. That's one of the reasons I love deep diving into all these different sacred texts, is they kind of remind us to see the other individual for who they are, created in God's image, as we might say in the Judeo-Christian tradition, or seeing the divine in the other in the Hindu tradition. And so I think first and foremost, it's to say, I need to get to know this individual and cultivate that relationship with them. And in so doing, as you develop trust, that's when we begin to become open to hearing from each other's different political perspectives. We've seen this work with some of the most difficult members of Congress. We've utilized this model, and it's very effectively. And we've seen people that have gone from being completely antagonistic to this approach to being champions of the approach on both sides, honestly. And so I think that's. But it took time. We didn't come in finger waggy, telling them what they were doing wrong. We spent time building the relationship, and then inviting them to see what was happening in communities. So certainly, I think with the relationships that you all have had historically, you've got a great government relations team here at A&M, inviting them in to go see what's happening with your work in Guatemala or Afghanistan is critical to helping them make more informed policy decisions. So we talk about our policy work. We're not an advocacy organization, neither are you. And so our model is called informed engagement. We want our elected officials to be well informed about the policies that they're debating and discerning, so that they're leaving the world better off than they found it. And oftentimes, as you know, many of you know very well, they are not informed, and their decisions are not informed. They might be based upon an anecdotal experience or something they heard, or just their political perspective, and so that's what we want to achieve there. Good question. There's another question. Yes.
How do you measure impact of your program? So besides, for example, your meals to you program,
Yes.
besides actual meals delivered, what other outcome variables are you?
Yes. Great question. We have a lot of researchers at our team, and so they're looking at the interventions from a lot of different perspectives. So I'll give you one example: school breakfast program. The National School Breakfast Program in Texas. What we found is that schools that offer the free introduced lunch program, they also oftentimes offer the free breakfast program, and it's before school. And so if it's offered before school, you typically only have about 30 to 35% of the children that are eligible for the program participating in the program. And we figured that if based upon some work done in South Texas, that when you change the location of where you have breakfast to having it after the bell, typically in the classroom, that it triples participation in the program. And so our team evaluated the efficacy of that program. So if you one of the things they looked at for the individual student was the nutrition. It was a nutritional analysis. So how they looked at the physical health and well-being of the child to see if it was improving health outcomes because they were having at least 2 consistent meals a day. It also improved academic performance in math and in science particularly. That's where we saw the biggest jumps. I think the third was in performance in English. What was the third category? And so everything it's aspirational. Our projects, we want all to be based in real academic evaluations, so that because we can't scale it otherwise. right? And so with that particular project, we were looking at 10 different school districts and seeing the effectiveness of that intervention. It worked in terms of serving meals. We served 200 million more meals to kids over a 2-year window through that intervention. And now 400 districts in Texas operate the program. But first and foremost, it was like looking at health outcomes and looking at academic performance was the way we evaluated that program. But because every intervention is so different, you have different types of evaluation. So with Meals to You, the rural food distribution project, we have a nutrition-based team based out of Duke's Global Health Institute. We didn't use the 2-year school down the street from Duke as our academic partner. Not that they're the best 2-year school in the state of North Carolina. And
Jeremy.
that's it. You're welcome. And then we had our lead program evaluation done with one of our in-house researchers, Dr. Craig Gunderson, and the Urban Institute. And then we have 3 other different evaluations looking at everything from how this affects disaster preparedness to a number of different things on that particular project. So,
Just out of curiosity, and maybe this is for more
Yeah.
research people
Yeah.
too, but in terms of these types of interventions, you go through like an entire randomized controlled trial where you have a control group and you're comparing it, random selection and making sure the groups are comparable and all of that.
typically, no. We'll oftentimes do what's called participatory action research because, and this is, so I do not consider myself an academic, but a practitioner. And for me, if we have the knowledge to be able to positively impact a particular intervention group, it's hard for me to say, let's don't do it. Having said that, we intended for our Meals to You program to be an RCT, but because everybody ended up signing, the robust amount of kids that ended up signing up for the program, it ended up having to become more of a longitudinal study instead. So, but yes, I mean, RCT, so that's one of the things that our team has been talking with Rudy and his team about expanding that component of what we offer. Our lead researcher, Dr. Gunderson, has done and been involved with dozens and dozens of RCTs himself, but we haven't done that organizationally yet.
And
Great question.
to add to that, I don't know if it's still going on, but when I was Undersecretary FNS, we did do that research. In addition to that, we also reached out to the research folks at a part at USDA, and I think the RAND Corporation.
Yeah.
We also contracted with the RAND Corporation to actually do the research that you're talking about, but we did it nationally. And so, like I said, I don't know if they still do that, but when I was Undersecretary, we did provide grants to do the type of research that you're describing to talk about the impact. And one of the things that came out of that was what Jeremy was talking about, because I was essentially the Undersecretary that moved breakfast from beginning to the beginning in homeroom, and also changed the food that was served, because I know that Dr. Davis is going to find this hard to believe, but they were serving cookies and some other stuff, and I essentially said that wasn't nutritious enough and moved it to fruit and to low-fat milk and some other things.
That's right. One thing that I will say so we have a research fellows program. We have about 55 participants in the research fellows program. Those are faculty members from universities all across the U.S. And we'll have a global component as well. When we have an intervention, so let's say, USDA comes to us and they say we want to do an innovative, project with, addressing rural child hunger, and we want to have an evaluation component. We put that out to our research fellows first to see if, and so that was kind of a cadre of our research fellows, these 5 different research projects on that particular intervention that emerged. So if you are a program evaluator, if you are involved in doing RCTs, those kinds of or longitudinal studies, particularly longitudinal studies in developing countries, that is definitely something we'd love to talk to you about, and love to visit with you about maybe being one of our research fellows, because that is they are the ones that administer our research grants.
I think somebody had a question over here.
Yes.
I was wondering if you have any interventions in the lines of redefining the people list and redirecting that to make impact in food security.
Yeah, some of our there are a couple of things where our team has worked in that particular space. Certainly, school districts throw away a lot of food on a daily basis, and so there is a Good Samaritan law that's a federal law that essentially allows you to, if you repurpose that food that was going to get thrown away for a charitable purpose, it kind of makes you don't have to worry about a lawsuit essentially. And so we've worked with restaurants and school districts to say, hey, let's look at food that we would have thrown away and let's repurpose it at like shared tables and those kinds of things at schools, so that kids can leave with additional food instead of it being thrown away. So we've been involved in that space. We have not been involved, we throw away about 100 million pounds of food annually in the U.S., and most of that is food that we're plowing over in farms. Feeding America has partnered with USDA on recovering some of that, but that's not been a project we've been a part of. But it's certainly, if you just take the pound, if you assumed, kind of that those pounds could be converted to healthy quality meals for individuals, that would essentially be enough to address food insecurity comprehensively in the U.S. alone. So it's a huge area of opportunity. Is that something that you research? All right. Well, let's talk before I leave. Yes.
So a lot of what you're saying, like, hits home for me personally. I grew up in Beeville, which is a tiny.
Yeah.
Or is
Yeah.
that something that you're not involved in? You're just looking at the food and that sort of
Yep. We don't have any interventions directed towards that particular, towards when you think about economic outcomes for a particular family. Workforce development is typically in that space. My previous job we did, and so that you're right. I mean, you're exactly right. So if you think about how do you break the cycle of poverty, first and foremost, it's creating economic opportunity through employment. I think one of the things that we can do a better job of in society is being honest about where employment opportunities are if you want to be gainfully employed. Whether that's going to college or going to getting a technical school, going to technical training school, getting certified as a plumber or an electrician or a carpenter. We cannot find enough of those people in Texas right now to keep up with the growth, and that's before we're about to get this influx of infrastructure funding too. So I think that's a super important area, and I appreciate you bringing it up. And it is a pervasive problem. And oftentimes, as you know, if that's what is mirrored for the child growing up, that's what they know. That's what they know. And so oftentimes they move into these same jobs and have the same kind of economic outcomes. And so that's where you see generational poverty. And so important interventions, like my mom grew up as poor as you could be in the U.S., kind of that Appalachian poverty. My grandfather was basically a cotton sharecropper in that area. And my dad described that you could see the boards through their house, outside, and no running water inside or anything like that. But she was able to go to college, and it completely changed the trajectory of our family. And so I think looking for ways that we can educate kids so that they know what real opportunities are could be a great way forward, but also workforce development programs are also great.
Last question, I think your last question.
Yeah, I had kind of similar question. First of all, thank you for doing an amazing job for feeding hungry people. But listening to what you're doing, I was wondering if you're planning to do something to support those people to feed themselves one day, so they won't rely on free food for the rest of their lives.
Yeah.
So in Africa, we have a proverb saying that, don't give me the fish, teach me how to fish.
That's right. Yep. I would say a couple thoughts. On a global level, there are 5 particular programs that we'll work with the World Food Program on, and one is strengthening smallholder farmers. And so some of you have partnered with the World Food Program and USAID on similar interventions, and so it is helping equip them either with drought-resistant crops, or providing small business loans so that they can expand their operations, get more food to the market. And so in that capacity, yes. Here in the U.S., I think I want to go back to the point to say people that are utilizing these programs in the U.S. are working. So it's not an issue of people not working, it's an issue of underemployment in most of these cases. And so, the SNAP program is, the window that most people utilize the program is a 9-month window, in the US. And so I think, so for us, it's important, A, that we're maximizing utilizations of these interventions, so that people can, have an opportunity to get back on their feet, go to school, whatever it is that they need to do. But it's not an issue of if they choose this path, to utilize the program, in most cases, that they're choosing not to work and look for other opportunities. But this is supplemental income. And so one of my colleagues from the previous administration called it a work support program. And that's really what it is, until we begin to see how we can improve wage rates to also rise with the rate of inflation. So, good question. I'd love to talk to you more about that.
And I think to add to that, it's one of the things that having run those programs, one of the things that most Americans don't know. They believe that people that receive or participate in the food stamp program are on there for extended periods of time. Right now, there's 45 million Americans enrolled in the food stamp program. Over 50% are working. They just don't make enough money to be able, because it's based on your income. And so they are working, and the average time is 9 months. And the other thing that most people, Americans, don't know is that over 30% are children.
And utilizing these programs to their fullest capacity. So if you think about the school breakfast program as an example, so many of the people that are working, serving the food to our kids in our school districts, if they're only serving lunch to the majority of their kids, then that reduces the amount of shifts that a cafeteria worker is going to get. And so if you expand access to the breakfast program and add the after-school meal program, which is now in development, and becoming more robustly participated in, all of a sudden you go from a 4-hour shift to getting an 8-hour shift. If you utilize the summer meal program more, then people who are laid off in the summer are now all of a sudden employed through the summer, and so they are able to then provide more meals to their family because of their increased employment opportunities. And so that's where it has that, and that's why the food stamp or SNAP program was designed the way it was, is because it has such economic impact both for the farmer, for the grocery stores, for the food, for the supply chain logistics folks, as well as the end user, who, as the ambassador saying, is overwhelmingly employed. And that's when you say 50%, that's of the total population. When you look at the working age individual, it's a much higher percentage of people that are of workable age, either in retirement or children that are.
And on behalf of the Borlaug Institute, we have a small gift, a token of our appreciation for coming. We really appreciate it.
Thank you.
There you go. We appreciate it. Thank you so much.
You think they'll let me put this up in my Baylor office? I think so. It's required.
So thank all of you for coming, and thank all of you who signed in virtually. We're so glad to have all of you. Everyone have a good afternoon.
I'll email you about the school breakfast.